examined him. No one touched him. No one tried to figure out the cause of the pain more than what he described. He was shocked. I was shocked because the doctor needs to examine the patient. That's part of what we do, especially someone who's coming in the emergency room. This is a high-caliber person. He's very intelligent, and he was shocked that no one examined him. So it's something to think about next time you see your doctor. We have Gail on the line from Somerville, New Jersey. Good evening.
Good evening, Dr. Lederman.
How are you?
Good, and yourself?
A-OK-O.
Great. I'm calling because I keep hearing the word radiosurgery, and I've been coming to your office with a friend who's getting treated very successfully. And we talk with the patients and so forth that are there. And a lady the other day said, this place is just so joyful. She said, it doesn't seem like a cancer center. She said, everybody's talking to each other and they act like they're enjoying the visit. And I was thinking about you keep saying radiosurgery, and people don't understand that it's usually not surgery.
So now, what is it? How would you explain it? What would you do differently?
Okay, I would say this: if it's I can't even think of the word, but anyway, I'll remember that part of it. But the radiosurgery, I would suggest that you call it radio beaming, BEAMING.
Hey, you changed it. Last week you told me I should do radio zapping.
Well, I thought zapping was good, but maybe the beaming sounds better because it sounds more pleasant instead of funny. But either radio zapping or radio beaming would be great, because when you say radiosurgery, people think they're coming in for surgery, and even though you say no cutting and no bleeding, I remember hearing you say that on the radio, and I thought, well, I can't figure out what he's talking about. No cutting, no bleeding, but he keeps saying surgery. So what it actually is radio beaming, and the radiation beam, shoots like a laser beam or something, and it goes immediately, like you said, to the tumor, not to the surrounding tissue. It goes exactly to the tumor, that you've set it to go to, and zaps and kills the tumor. So that's what I say radio zapping, because it zaps the tumor and kills it.
The problem is excuse me.
Maybe radio beaming is the better word. I don't know. I'll let you decide.
Well, it probably is. The word came from a neurosurgeon, Lars Leksell, in the 1950s, and he was a neurosurgeon in Sweden that used to cut people's heads open. So when he came up with the word, he was trying to denote that instead of cutting with a knife, they were using the radiation beam to cut like a knife. So the radiation beam would be equivalent to his knife without the cutting and the bleeding. And that's how he came up with the word radiosurgery, and it's stuck in the medical profession. So that's why we use it, because there's a historic precedent for it over about 60 years. So you're right about making it understandable to people. And that's why I usually say radiosurgery is no cutting, no bleeding, to distinguish it from open surgery.
Right, because it's so simple. The patient comes in, they lie down on a pleasant, whatever you call that thing that they lay down on
table.
A plane.
There's a stereotactic frame on the table, on an accelerator table.
Right under the machine, and then the machine sends the beam. They don't feel it, they don't see it, they don't even know it, and they get up and they walk out as if nothing ever even happened. But wonderful things are happening because it's zapping the tumor and killing it without destroying the tissue around.
And you know that because you've had follow-up. Your friend is not you. Your friend has had follow-up testing to prove that, right?
Yes, absolutely.
Okay.
And they've been very pleased, and the other people there. And we've seen the lady that was 100 years old you mentioned, we've seen her, and then there was another lady that came in.
That woman was 100 years old who was bleeding out from her bladder cancer. Her bleeding has stopped.
I heard you say that, and
yeah.
I wasn't surprised because, it's very, very effective, the radio beaming.
Well, sometimes when you can't see a beam, you wonder if it's really working, so... it's kind of like a magical beam. But for her, she was bleeding out. She lost half of her blood. And after her second treatment, the bleeding stopped.
That's wonderful. And I know the lady that had the brain tumor, I remember the first day she came in from a hospital, and she wasn't doing well at all. And you gave her first treatment. And I think after that first treatment of that radio beam going in and zapping that tumor, that she became aware, and her daughters were just thrilled. They
Yeah.
said, she can talk. And I've seen her a couple times since, and it's just amazing. I said to her the other day, I said, you're sitting up so straight and alert. You look wonderful. She's, I think, 82 years of age.
Yeah, and they're planning
And,
to have a holiday in Miami, Florida the next week or two. So
I'm taking her with them.
yeah,
she looks like
she's
she
going to
could.
Miami.
Yeah.
She's going to Miami. Yeah, of
It
course.
looks like she could.
Yeah, I'm talking
And
about
from
the
the day
patient.
Right, and from the day she came in, you would have never dreamed that. So, to the people who are listening, I'm saying it's radio beaming, zapping the cancer. And as you say, there's no surgery, there's no cutting or bleeding or anything like that, and they don't feel a thing.
All right, well,
It's
thank
magical. It's magical. You're right.
you. We call it the magical beam. Thank you very much.
That's a good one. The
yeah,
magical
that's a good
beam.
one. That's even better.
That is. Okay,
Yeah.
God bless you so
All
much.
right, God bless you, and thank you.
Oh, you're welcome. Good night.
We had a caller who was calling in about the study that looked at watchful waiting versus treatment, and they left the line. So I apologize, but you can call me during the week. Our office number is 212-CHOICES, which is 212-246-4237. We have booklets about brain tumors. We have booklets about body cancers and booklets about prostate cancer to send out. We send it out at no charge to you with the DVD. So that number is 212-246-4237, 212-246-4237, and an easy way to remember it is 212-CHOICES. So we welcome you to call for an appointment. We guarantee we'll see you within one business day if you want. We believe that we're not only super convenient, we're located by most subways, trains, buses, Grand Central, Penn Station, PATH, Port Authority, so it's easy to get to us. We believe that you should give yourself the most chances by giving yourself the most choices by calling us at 212-CHOICES. We do accept most insurances, Medicare, Medicaid, and the goal is to try to provide the best possible treatment for you. Many people ask our exact address. It's 1384 Broadway. There's 50 million people who come to Times Square every year, so if you want to come to our office while you're at Times Square, you're welcome to pick up that information. We're located right between Macy's and Times Square, a couple minutes away from each. We have a modern, spacious cancer treatment center. It's a private center, which means it's not funded by the drug companies or surgeons or anyone else. It means you're our boss. And we always believe when you're a patient, you are the president of the United States of your body. So you get to choose. You get to be informed as to the options. And we always suggest a second opinion, a fresh second opinion. And then you decide what makes the most sense to you and what's the best data that supports the opinion. So you can call our number day or night, 212-CHOICES. You can speak directly to the doctors like you heard tonight. You don't get the machine, you don't get the students, you get the doctor, so it's very different than most other places. I want to talk about a new research article that actually looked at economic disparities in mortality after cancer surgery. So guess what? And once again, people in lower socioeconomic status have higher mortality, that is death rate, during surgery. So there was a study that was published in JAMA Surgery. So JAMA, again, is a journal of the American Medical Association Surgery, prestigious journal. It looked at 596,000 patients undergoing removal of their esophagus, pancreas, stomach, colon, lung, bladder between 2003 and 2007, and looked at socioeconomic issues. And patients in the lowest socioeconomic group had the highest rate of complications, the highest rate of mortality, and the highest failure to rescue. Failure to rescue means the patient has a complication, and then do the doctors in the hospital rescue the patient. So again, patients in the lowest economic groups had a higher rate of complications, higher mortality, and higher failure to rescue. And the complications rates were 25%, mortality 10%, and failure to rescue 26%. So there is a hospital effect. we believe you might get the best treatment by staying out of the hospital with less complications, less infections. You get with us, get a treatment in 15 minutes and go home, go to work, do your thing, avoid cutting, avoid bleeding. So we can't treat everybody. We know that. We try to be honest with everybody. We cannot treat everybody, but you may want to stay out of the hospital, avoid the infections, avoid the complications, and give us a call at 212-CHOICES. 212-CHOICES. Get the booklet DVD. You can speak to us and make an appointment, which is the best way to find out what your best options are. So again, thank you for listening. Have a great week, and God bless you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed, 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 or the